I going to lose my hair is one of the first questions a woman asks when diagnosed with cancer. For a woman who wants to maintain her pre-treatment appearance, a medical hair prosthesis is the optimal solution. An MHP system is an integral part of the treatment. It is truly an excellent resource to help patients on their pathway to recovery.
My name is Sharon Blinn. I'm an ovarian cancer survivor and the founder of Bald is Beautiful. No matter what the reason for medically related hair loss, it is often considered one of the most emotionally difficult aspects for women to deal with regarding their health. My experience with chemotherapy inspired me to create Bald is Beautiful, to encourage women to embrace their health journey with a sense of adventure and self-acceptance. If a woman chooses to wear a medical hair prosthesis, it should be a positive aspect of recovery, and it can even be a fun and creative part of healing. It can be difficult to cope with the challenges of wearing a wig on a daily basis. A medical hair prosthesis is a very different approach in maintaining a pre-treatment appearance and should not be compared to an unnatural-looking wig. Here is Lynn's story.
After being told I would need chemotherapy, I called the American Cancer Society and asked for resources for wigs at salons in New York. This is the second time I have to receive chemotherapy. I wanted to look as normal as possible. My thought was that if I could look well on the outside, I could handle anything going on the inside. I was given the name of 3 salon locations. As we walked in the first salon, the woman greeted me and immediately had me sit in her chair. She did not ask me anything about my own personal expectations or preferences. She had me put on what looked like a bathing cap and plopped a wig on me. The wig had long, bone-straight, auburn hair. It could not have been any farther from what I currently have. I started to have a hot flash and literally began to sob in her chair. I thought, who was I kidding? This is never going to work. I am sick and now ugly and have no control over anything anymore. I ripped the wig off and put on my coat and walked out of her salon, almost forgetting my mother was with me. I told my mother I did not want to talk about any of it and was completely immobilized by my experience for almost 3 days.
Unlike the depression that can result from wearing uncomfortable and unflattering wigs, the experience of utilizing an MHP system to recreate a woman's exact hairstyle will better support her psychologically. Bringing positivity to each aspect of her treatment will increase her chances of a successful recovery. This approach, combined with a special design, is what makes an MHP system very different from a wig. The basic rule in the Joseph Paris concept is, if the patient looks in the mirror and sees only the wig, then that wig is not therapeutic for the patient to wear. The hair must look real in order for it to feel real.
By definition, the word prosthesis is an artificial device used to replace a missing body part. So technically, an unnatural-looking wig is also a prosthesis. However, when being prescribed to a cancer patient, only the natural-looking prosthetic has any beneficial qualities. Only by preserving her pre-treatment appearance are we helping people like Lynn.
When I went to Joseph Paris's cheerful salon, Joseph Paris and his son, Joseph Jr., met with my mother and me. He asked me how I was feeling, what treatments I was currently having, and when I was going to start chemotherapy. He assured me he would help. He was very active in the American Cancer Society. He knew exactly what my concerns were. He showed me pictures of other clients who had chemotherapy and their before and after pictures. He showed me around his salon and showed us how the hair systems were made. He introduced me to his staff, the hair designers, and showed me hair samples. Joseph told me the difference between other wigs and his MHP system. He even said that my own hair could be incorporated into my new hair system. He showed me how I could make my new hair curlier or softer depending on my needs. He showed me how easy it was to care for it and how comfortable it would fit on my head. He also said it could be adjusted as my own hair grew in. He showed me how the cap portion was virtually transparent and would blend in with my own skin tone. Joseph said that it would only take 2 weeks for the whole process of making the hair design. Joseph would also be available to shape my hair differently or adjust the wave if I preferred. Joseph Paris and his salon staff gave me the ability to still be me during my own personal ordeal. Thank God I found someone to help me through this process. Again, I felt that if I could look the same on the outside, for myself and the people around me, I could take care of the inside. How fortunate I was to persevere through my dark and depressed moments and find a perfect solution to my hair loss. I thought of the others who may not be so lucky.
The beauty of the MHP system is that it can be ready to wear for the patient in a couple of weeks. In the past, this would have taken months to accomplish. This will give the patient additional confidence knowing that should she want to wear an MHP system, she will have the best possible tool available to maintain the look she is accustomed to.
What makes the MHP design unique is that we can cut and save her own hair before she begins treatment. We can then utilize that saved hair to recreate her front hairline, having it appear as if she's never lost it.
The oncology coordinator and the MHP system associate must work together to help the patient feel better about her appearance while on the road to recovery. Patients with medically related hair loss who would like the option of getting an MHP system should do the following. 1. Before starting her chemotherapy, take a digital photo of how she wears her hair from all 4 sides. 2. Along with the prescription and the diagnosis code, the patient will need a statement in writing for insurance purposes. The statement must indicate that the MHP system is prescribed for her mental well-being. 3. Once the doctor has prescribed an MHP system, the patient should get an estimate. 4. Prior to purchasing, an estimate of the MHP system is sent along with a copy of her prescription to her insurance provider. This lets the patient know what they can afford and helps them pay for the cost. Citibank offers a no-interest loan that will help cover any part of the cost of an MHP system that is not covered by their insurance company. 5. No matter what specific medical condition, after purchasing an MHP system, the state of New York will refund the sales tax for the purchase. There's a special form for reimbursement, so be sure the patient's tax preparer is aware of their purchase.
I'm Joseph Paris, and I have designed hair systems over the past 40 years for film, theater, and television. And I know how unforgiving the eye of the camera can be. What would cost a Hollywood production over $5,000 to make look natural on film is now being made affordable for patients to use in their daily lives. Here is Sharon wearing an example of what is cosmetically acceptable. It looks and feels so natural you'd think she was born with it. Wearing an MHP system that looks natural is very simple to maintain. Maintenance will be just as easy for her as when she had her own hair. This design is an excellent psychological tool used to support patients throughout their chemotherapy treatments to what will be hopefully a cancer-free life. The advantage to deciding on an MHP system prior to treatment is it gives the patient time to make an informed decision. It also adds a new level of comfort knowing it can be designed using her own hair. These ideas are designed to help the patient's mental stability through an otherwise emotionally trying experience. Here's my son Joseph. People find it hard to believe that he's wearing one of my MHP systems. Unfortunately, hair replacement programs are not in place for men who are experiencing medically related hair loss. Not every man is confident with a shaved head or a bald look. The MHP system design now gives them an option. A percentage of sales of the MHP system will be donated to cancer research. We urge oncology coordinators to direct their patients towards this new innovation. We believe in our hearts this concept will play an important role in what is the hope of every patient, a successful recovery.